My father loved that we were noisy. We were a big noisy group and big personalities. And he always loved to have us making noise around him. Those were our best family gatherings. And so it was, for me, it was that one last jubilant family gathering that we could have. And I just don't think it would have been possible if the Ann Calla unit didn't exist.
I think the fairest way to put it is I'm not sure what we would have done without it. We would have been in a very awkward position, shopping around to try and find the aid. Her condition was such that I suspect she didn't warrant hospitalization, but we needed a level of care almost equivalent to that at home.
So I never had that experience of going into a hospital ward, but seeing it almost like a lovely bedroom at home or a beautiful hotel, very beautifully furnished, comfortable, and that's just the physical space. The people who were there were so comforting and professional but kind. They always have time to deal with you if you had a question.
We knew what the reality was going to be, but we didn't know the pathway of getting there. So their help and their advice and their assurance was just so beneficial, just so good.
The possibility for us to be all gathered in one room, but also to have the kitchen facility there so that we could have a meal together. It gave my stepmother something to do. She wanted to cook. It kept her busy. We spent several nights there with him, and so having the shower facility there just allowed you to freshen up. Volunteers had, toothbrushes and certain, shampoos and so on, which just made things so much easier. And it meant that we could stay with my father throughout, which is, of course, what we would want to do. It was certainly the closest thing to having him at home. And it really, it made it so much easier for us. And the nurses there and the doctors, Dr. Dentino, all of them are just so beautiful. And they're so kind, and they certainly, when you're with them, they make you feel like you and your loved one are the most important people, at that moment.
When the hospice palliative care people came into the picture, they immediately took over the planning, of course, and the direction. It made our lives in a difficult time just so much easier. So we were satisfied we were able to provide then the level of care that my sister needed in those last months of her life. So we would have been in a very difficult situation without their assistance.